Welcome to Adapt NCLEX, and thank you for joining us. This is version 2 of the stages of labor as you try to understand maternity and these areas of questions that they usually ask you that require a little bit of content to answer the question. So we'll go through some areas that I want to emphasize so that when you see questions on that, you'll be able to answer it. It's mastering of maternity. You can watch this video multiple times and use it to answer any questions regarding stages of labor. So this is the question. A nurse is monitoring a client receiving Pitocin for labor induction, right? Mommy is receiving Pitocin for labor induction. The fetal heart monitor shown below. I used the first one to show you how you can break the question. This is the same thing we answered yesterday. So, which of the following actions should the nurse take? So the same thing. Select or apply. What action should the nurse take? What the nurse is monitoring the patient is on Pitocin for induction. And you saw this. Can you read the EKG? This is part of the stages of the labor. Something is happening. I'm monitoring the mommy, receiving Pitocin during labor. What should you see? Or what actions are you going to take? Right? If you look at this, this is a maternal contraction. What is happening to the mother? Baby, right? When mommy contract, what is happening? You can see here, when there is no contraction, as soon as you contract, nothing is happening to the baby. But at the peak of contraction, the baby heart rate go down. Same thing. At the peak of contraction, the baby heart rate goes down. At the peak of contraction, the baby heart rate goes down. This is what? Late deceleration. It's not early deceleration. It's not variable deceleration. Then you ask yourself, what is late deceleration? What is causing the problem? This is what? Placenta insufficiency. What would you do? Improve blood flow to the placenta. So what do? You can use your lion if you want. But the first thing you do, right, in this situation, you can use your lion, and that means position. What kind of position are you supposed to take? Should you pay the patient the knee to chest position? Do you decrease the Pitocin rate? Do you give the patient oxygen through nasal cannula? Do you increase IV infusion? Do you document the finding and continue to monitor? If you know the answer, you can put it down. But this is a content regarding the deceleration on the patient receiving Pitocin. What do you think? There's certain things you have to do. So, mommy is receiving Pitocin, and what? The baby is having late deceleration. What do you do? Fine. You got to change position, right? If they're receiving Pitocin and they're getting late deceleration, you don't decrease the rate. You stop it. So this is wrong. If it's a late deceleration, position is not knee to chest position because it's not called prolapse. It's what? Placenta insufficiency. Therefore, this is also wrong. If you use your lion, you know you got to give them fluid, right? IV fluid to allow blood flow. You know you got to give them oxygen, but oxygen should never be given in a laboring patient using nasal cannula. You want to use non-rebreather. This is not normal. Therefore, don't document the finding and continue monitoring. I intentionally set this question to tell you, select or apply for the new generation NCLEX. Next gen, you don't have to pick everything. Just because you know I got to pick something about position, don't pick it. Pinch yourself. There is only one answer there. 5 answers, only one answer designed to trap you. Bring your content. You know you shouldn't do that. Don't put them in the knee to chest position if it's late deceleration. Therefore, there's only one answer, and that's number 4. Pick it and move away. Don't worry about it that, oh, I'm picking one answer. So just pick it and go away. Number 3, during the second stage of labor, what are the characteristics of the second stage of labor? Which assessment finding will indicate the need for what? Immediate intervention. You have to know second stages of labor. That means what? Mommy is ready to deliver the baby. Therefore, which of this, when I see it, I should worry, right? Second stage of labor. Mommy is tired. Well, she's been contracting for a long time. Is that bad? Fetal heart rate is 90. Is that bad? There is blood show from the vagina. Is that bad? You've seen the crown of the fetal head. Is that bad? Bring your content. I need to deliver the baby at stage 2. Therefore, I should expect the baby crowning. 4 is no problem. If I'm going to have a baby, I'm going to have a blood show, right? All of these things are normal. I'm going to get tired because I've been contracting for a long time. It's not good to have fatigue. But I see heart rate of 90 of the baby, that is deceleration. Bradycardia is deceleration. They may not use this word, but they put it in answer choice and say, oh, baby heart rate of 90 is bradycardia. The lowest they can go is 110. Therefore, number 2 is the patient finding you should intervene. This is a deceleration. 1, 3, and 4 are expected. Right? So this is the way you'll be seeing questions like that, and then bring your content and do the same thing. Nurse is caring for a client in the transition phase of the first stage of labor. First stage, mommy check-in, we get her ready for baby delivery. What do you expect during the first stage? Which client behavior is most typical during the phase? Yesterday, I told you that to master labor and delivery, know the stages, know the behavior of the mother, know what you have to do for each stage. Then the 4th one, emergencies. Stage 1, it has 3 phases, phase 1, 2, and 3, right? Mommy is in transition phase. Transition phase is where you transition from stage 1 to stage 2. What do you think? At the end of the transition phase, you are about to go to stage 2 to deliver the baby. You're not going to be asking questions and being excited. You are in the mood to deliver the baby. You've been screaming, sorting your husband. This is the time. You can't be sleeping between contractions. This is like you are on fire. At this stage, you are on fire. It's an intense stage of labor. You're going to be irritable. You'll be yelling. You'll be pulling people. You'll be feeling out of control. Yes, you're not going to have the urge to urinate because that occurs early as the baby descends. So you can get in the latent phase, active phase. It's not unique, but the transition phase, when you're getting ready to deliver the baby, you're on fire, like on steroids. So you're going to be irritable, you'll be feeling out of control. So 3 is your answer. I'm trying to use this answer choice to show you. I try to make it easy as much as possible so that you can know the master the stages when you go through. So 3 is the right answer. Same idea. Which maternal behavior is most expected during this phase? And this is assessing a client in the latent phase of the first stage of labor. That is the beginning of the first stage. Mommy is like 0 to 3 centimeter dilated, 30% effaced. She's so happy to have a baby. She talked too much. Everybody is happy. That's all. She's not going to be requesting pain medication because that's the trap. She will not be contracting that long, very short, in the very, like every 5-10 minutes. So she doesn't care about it. Mild contraction. She doesn't cry because the contraction is very small. And so test taking strategy, you can see 1 and 2 saying the same thing but in the different language. Talks through contraction and seem what? Excited because the contraction is not that great. So she will be talking and nobody know that she's contracting. She refuses to talk and appear withdrawn. No, that will be probably getting to the active and transition phase when everything's on fire. So 3 is your answer. Same idea, right? What is the most appropriate nursing action? The client in the active phase of labor. That means active. That's the second portion of the stage 1. Is having contraction every 3 minutes. The nurse notice what? Early decelerations on the fetal monitor. What do you know? What are your actions when you see early deceleration? You can write your VCHOP and it will tell you early deceleration is okay, right? This baby head compression. It's nothing to do. Just continue to monitor, making sure baby is doing okay, everything is going well. There's no magic. You don't prepare for C-section. Oxygen is not needed because the baby is not in trouble. Repositioning of the mother is not. Don't pick position every time you see a question. Read the question. Early deceleration, that's not required. All you need to do, continue to monitor the fetal heart rate and make sure it's not bad. So number 2 is your right answer. Number 7. A nurse is caring for a client in the transition phase. We've seen it. Transition phase is the last stage of stage 1 as you progress to stage 2. So the following findings should be reported immediately. Mommy is going to have baby, so you got to be sharp. I'm going to have baby, and I'm going to stage 2 now. Which of these, when you see it, you should worry? Complain of rectal pressure. Oh, the baby is down. You're going to cause rectal pressure. It's suspected. I'm going to be irritable and with restlessness. Just because you see restlessness, you want to pick it. It's the intense stage of what? Labor. Mommy is going to behave that way. She's going to be acting out because she's in the mood. The baby heart rate is 90. That is deceleration. You see what I did? I changed its question frame like we saw before. That is the same thing. So if you don't pay attention, you pick something else. And the last one is the shaking and vomiting. That is what you expect the mommy to behave at the transition phase. So I'm using these questions as a content to give you some lectures on labor and delivery so that you can be comfortable and answer. So 3 is your right answer. Number 8, which of the following finding during the 3rd stage of labor? That means what? Require immediate intervention. You saw this question, I change it, make it different. 3rd stage of labor means you already had a baby, right? And you're about to deliver the placenta. There have to be conducive environment for delivery of the placenta. The uterus has to be firm and contracted. The placenta is going to latent. It's okay. You're going to have gush of fluid coming out. That's okay. So if the uterus is firm with a moderate look here, oh, that's not that great. It's not that bad, right? Sudden gush of dark red blood is suspected in the 3rd stage. When the uterus is bulgy, when you palpate it, it's going to cause bleeding. That's not what you should expect in the 3rd stage of labor. The placenta will be delivered in 20 minutes after you have a gush of fluid and then the placenta comes out. So which one are you going to be worried about? It's number 3. A bulgy uterus upon palpation will lead to postpartum hemorrhage. So 3 is bad. This is same question in a different form. A nurse is admitting a client in labor or asks, what happens during the 3rd stage of labor? You see, questions does not need to be memorized by user content. This is the same thing as question 8. It asks you, what should you expect? This one, what is the behavior? Which of these do you know about what? 3rd stage. I told you 3rd stage is what? The delivery of the placenta. Which of these answer choice has placenta in it? A said begins with cervical dilation and ends with birth. That's not stage 3, right? That is probably stage 2. Begin with delivery of the baby and hence with the delivery of the placenta. I see placenta. I know I'm going to pick that one. Begin with full dilation and hence with crowning. That is stage 1. Begin with rupture of the memory and hence with the delivery. In between that of 1 and 2. So you can see only one answer choice as what? Placenta in it. Because you know stage 3 is the delivery of the placenta. So I'm picking number 2. And the last one. Last one. If you're online, try and see if you can answer. You can put down your answer. What's the priority nursing action? Be sharp, right? 1 second. Finding that is going to cause trauma to the mommy. A nurse who has just delivered a baby is in the 4th stage. What happened in the 4th stage? Which function priority assessment is important? Measure the mommy urine, assess their fetal heart tone, monitor maternal vital signs and fundus, and encourage breastfeeding. If you're taking the test and NCLEX give you this, which answer choice would you choose? Put down and let me see. A client who has just delivered a baby in the 4th stage of labor. What is the next priority action? Which one? Do you check the urine output, the fetal heart tone, maternal vitals and fundus, encourage breastfeeding? What do you think? Let me know. Let me know how you think. Put down your comment and then put down your answer. Let me see what you're going to select. So I'll give you 10 seconds. Try and think about the question carefully. See which one is the most important, which one is going to help with the situation, and which one is going to save the mommy from trouble, right? After you deliver, during the delivery, after you deliver, the most important thing is what? At stage 4 is the first 1 to 2 hours. The word said just. So 1 to 2 hours, hemorrhage is the most important thing. Maternal hemorrhage. So which of this will tell you that mommy will be hemorrhaging? Checking their urine output will tell you that. Assessing for fetal heart tone will tell you that. Checking maternal vitals and fundus will tell you that. Or letting them breastfeed. You know, the status of the uterus is what is going to tell you if they're going to bleed. Maternal vitals will also tell you if they're going to bleed. So the right answer is number 2. And I hope these 10 questions give you some idea about what you need to know for labor. And the next video I will make is about emergencies, shoulder dystocia, all the things that happen during labor and emergencies that will happen during rupture, placenta, and all the things that are associated with it. But these are a way to help you master labor and delivery. Health promotion, I've seen most people have problem with it. That's what I'm trying to give you. This is the areas that will give people problem. Take care of yourself. And if you're new, subscribe to Adapting Class or join our membership. And you get access to some of these videos. Take care of yourself and good luck.